Okay, good day, sir.
Hi, how are you doing?
I'm good. Thank you, sir. Okay, first of all, we'll begin with the introduction. Today, my name is Shehu Yusuf, Dr. Shehu Yusuf, student of Punima University, Rajasthan, Jaipur. I'm pursuing my master's in public health, second year. And I'll be conducting this interview here with our chief guests, a senior immunization expert and WHO medical officer and national immunization officer, and his focus areas are immunization policy in digital health, technologies, cold chain system, and implementation challenges in India. And it's no one but Dr. Mayank Shersiya. So you're welcome, and we would
Thank
like
you
to
so much,
hear a
Doctor.
brief introduction from your side. Thank you, sir.
Thank you so much, Dr. Shehu, for that kind introduction. So, I'm Dr. Mayank Shersiya. I'm working across the public health ecosystem for about now 12 plus years in India and supporting some of the other LMICs as well. So, my key interest areas has been immunization, health system strengthening, mainly the primary, both urban and the rural settings. And I have been working with the Ministry of Health and Family Welfare as a national consultant with them, supporting the development of the new vaccines, rollout of new vaccines in India from the time of rotavirus vaccine, pneumococcal vaccine, measles, rubella vaccine, tetanus and diphtheria vaccine. So I have played a key role in terms of the policy making around it, development of the operational guidelines, technical specifications, implementation rollout maps, and doing all the capacity building initiatives, so on and so forth. Then I have also worked across the public health ecosystem, mainly with a view of strengthening the comprehensive primary health care across the states and union territories across. I look forward to this interview. Thank you so much for having me.
That's nice. Thank you, sir, for that brief introduction. It was actually impactful and well briefed. So, sir, we want to start with our opening question. From your perspective, how has India's immunization program evolved in terms of policy and system strengthening over years?
Yeah. So thank you for that question, Dr. Yusuf. So I believe that India's immunization program has evolved from a relatively supply-driven vaccination initiative under the universal immunization policy to a much more now system-oriented, equity-focused, and a technology-enabled public health program. So there are some major shifts which stands out uniquely. First of all, like there has been a significant policy expansion in the vaccine coverage. We have moved the universal immunization program has moved beyond the traditional antigens to include vaccines such as rotavirus vaccine, PCV, IPV, MR, adult diphtheria, and more recently HPV, and which reflects a stronger evidence-based decision-making through mechanisms such as the National Technical Advisory Groups on Immunization. Secondly, there has been a strengthened programmatic approach through an equity lens. So we have adapted the learnings from the polio programs through Mission Indradhanush and intensified Mission Indradhanush. These have been campaign mode initiative drives. India shifted towards more robust micro planning, risk stratification, targeted outreach for the left outside population, special focus on the migrants, special focus on urban slums, tribal population, and some underserved districts as well. The third major strength has been the improving the consider has improved considerably as is the origin expansion, mainly with the electronics logistic management through even that is known as the electronic vaccine intelligence network. Now we have digitally more evolved through digital beneficiary tracking through UVIL and stronger surveillance and increased data driven review mechanisms. So further also we also witnessed the use of digital platforms during COVID-19 pandemic, wherein India developed a platform known as CoWIN, and that has been adopted by countries as a global good also. The fourth component, I believe, has been a very much around the lens of community-driven intensive activities, engagement of community leaders, development of very innovative IC packages for risk stratification There has been concerted efforts for the engagement of the community-based organizations. And now we are evolving towards designing more human-centered approaches because we understand there are still some pockets of vaccine hesitancy which that need some concerted and targeted efforts. So this makes India more from just a mere public health intervention to a more health system strengthening approach for immunization.
Okay, thank you so much, sir, for that session. So, sir, we'll be moving to immunization policy and governance. What do you consider is the major policy achievement in India's immunization program?
So one major achievement has been the sustained strengthening of the UIP as a national public good with some strong political commitment and domestic funding. So two things stand out here. One is there has been a huge focus from the political leadership, right from the Honorable Prime Minister's office. And second is the amount of investments done under the immunization program through domestic funding in terms of there has been instances where we have received support from the contributors like Gavi. India is now in a position which has now uh, sort of not only the vaccine manufacturing hub, but also sustaining the funding of the immunization program through its domestic resources as well, right from the implementation of the programs to also to the purchase of the vaccines for the beneficiaries. The second has been the vaccine portfolio expansion has been impressive. And that has always been, that needless to say, has always been evidence driven. There is a very robust mechanism for the NTAGI Secretariat, which is in place as universally known as the NITAG Secretariats. In India, it is known as NTAGI. And so India introduced the new vaccines while maintaining one of the largest immunization programs globally. Third, I believe the intensified efforts like Mission Indradhanush, this significantly improved the attention towards missed and some underserved population by various mechanisms which were institutionalized like due lists, headcount surveys, microplanning, and none and the least effort which usually the other programs taking, which immunization program has sort of being a front runner, is the interdepartmental coordination. So immunization program has always realized that health is not only a head Ministry of Health subject, but health is something which should be as equal for the other ministries as well. So it's not only health in all policies, but also health for all policies as well. So then
Yes.
another achievements has been system strengthening through the cold chain modernization. So we have now robust cold chain equipments. Also, we have piloting new cold chain technologies in varied geographical conditions like the deserts in Rajasthan to mountainous regions in Uttarakhand. And we have come up and seen some new vaccine cold chain technologies as well. So other is the digital enablement. We have global goods of even and Boven now, which is adapted to UVIL. And which is becoming a single source of truth for the immunization program, the use of UVIL application in India. So, which is going to make the program completely paperless and completely digitized from the right from the session side entry of a beneficiary to the longitudinal tracking of the beneficiary. So this is, I think, and then finally, India also demonstrated some extraordinary program agility during the COVID-19 vaccine, showing that the health systems can operate at scale rapidly, but when the political leadership, financing, and some digital systems align, it leads to health system strengthening efforts in much more broader ways.
Okay. So, sir, how effectively are national immunization policies translated into district levels implementation?
So I would say that India has a relatively strong policy translation architecture. We have it's a set mechanism wherein there is development of operational guidelines, there are microplans templates, there are training cascaded, there is a TOT model, like training of trainers model, which is cascaded down from the national level to the district level. there are review mechanisms in place, and then there is supportive supervision. So, because India is a federal structure and there is a complete policy translation in terms of the national team works as development of the templates and everything, the state teams, which is like obviously supported by the district and the block teams, they are the one who are leading the efforts in terms of the implementation and rollout of the programs. So there is policy translation which is being developed at the national level to the implementation at the state level. There is number one. But however, we have also witnessed that the implementation fidelity varies in terms like there are some high performing districts that typically demonstrate strong leadership. They have active review culture. They have accurate line listing, convergence with frontline workers such as the auxiliary nurse midwives, the ASHA workers, those who are the frontline mobilizers in India, and the Anganwadi workers, those who are also part of the frontline team. But in some weaker districts, we see that there is some policy dilution in terms of micro plans are not updated. The session plans are poorly implemented. There is some stock mismatches with the digital versus the stock registers. Then there is inadequate supportive supervision and some data quality concerns. Also, the motivation of the frontline workers is also important. Concurrently, like vaccine hesitancy usually dilutes motivation, and the weak incentive structures also weakens the motivation. But the issue is not rarely about the policy. It is mainly the implementation consistency and the local managerial capacity. So I would say that the policy intent has always been very strong. And also we have witnessed now with the recent NMHS data, like we are hovering around 88% of the full immunization coverage as a national average. So that speaks of the strength of the immunization program itself. But the issues sometimes are very local and that needs to be targeted and addressed at the local level.
Okay. Okay. Thank you, sir, for that. It was actually impactful. So we'll be moving on the digital health technologies in immunization. You have talked about previously. You've talked about the digital technologies and how the immunization has changed due to CoWIN, UWIN, AWIN. So we want to know what has been the impact of this digital platform on vaccine tracking.
I would say there has been some major milestones and some great impact in terms of not only in increasing the coverage, but also for system strengthening, which is now being replicated for other program strengthening efforts also. So the digital system, the digital enablement, which the Universal Immunization Program of India has witnessed, it is now being translated and adopted for the other public health programs in India. So I would begin by saying like, so vaccine tracking and temperature monitoring has one of the biggest uh, impact in terms of even it substantially improved the stock visibility. It reduced the stockouts, overstocking through the real-time inventory management. Then the remote temperature monitoring mechanism has led to like uh, real-time alert mechanism has led to swift action from the implementers at the district and the block level to prevent the vaccine wastage. So this has been a direct impact in terms of vaccine tracking and reducing the stockouts. So which we have also witnessed the rollout of even has also contributed financially because every the return of investment is almost double for the even system which was implemented. Then there is systematic beneficiary follow-up. There are now digital due lists, and the beneficiary registers have improved the tracking of dropouts. Particularly with the advent of UWIN now, we have digital due lists, so the due list is readily available for the frontline worker, which helps them to have a specific targeted mobilization activity, then which leads to uh, also catering to the issue of migration because uh, the having view lists which were paper based at times was difficult to maintain the list of migrants those who are coming in or out. But with the help of digital view lists, the issue is also being now addressed and being taken up. Then digital enablement has also led to increasing in the session monitorings in terms of the supervisors are now able to better track the planned sessions versus the conducted sessions. They are able to have a better visibility of the vaccines and the logistics talks, and there has been some extraordinary data analysis in terms of having some performance trends in terms of what we are now trying to collate is using all the data sets in terms of not only the coverage data but also the AEFI data, also the vaccine stocks data. So they are all being collated together, they are all being analyzed together, and what a uh, implementer at a district level will get to see is a complete dashboard of the entire immunization ecosystem, and they are able to visualize what are the key areas where are certain gaps are left behind and what can be the changes which needs to be adopted. Then there are some AFI reporting issues which are now being tackled through digitization in terms of reporting. The timeliness of the reporting has improved. Obviously, the quality and the causality documentation still varies, but digitization is a process wherein we are helping in early signal detection, and the field investigation will always remain a part of the implementation, which is always crucial. But with the help of digitization, the signal detection rate has improved, and the data quality system is improving now with the constant checks and balances in the data system. So the obviously the issues like the poor data entry, delayed synchronization, and denominator issues, they still affect the reliability. But overall, if we say that the program is always constantly evolving, and we are trying to address such issues also through a unified dashboard mechanism for that. And what we have also learned that digitization it improves visibility, but the governance mechanisms improve quality.
Okay, thank you, sir. And sir, also previously you talked about the cold chain vaccine logistics earlier, and you talk about how it has also been used. So we will want to know what are the major operational challenges in maintaining that vaccine potency and logistics.
So, operational challenges pertaining to, I didn't get the last part.
Okay, I think I should come again. You talked about the cold chain vaccine logistics. So we want to know what are the major challenges, the operational challenges in maintaining those vaccine potency and logistics.
Okay. I would say because there has been a robust investment in the cold chain equipment system in India. So, but there are certain pockets where we still find there is uh, the problem of high reliability on power that remains a challenge in some remote areas. There are now solutions wherein we are adopting solar and backup solutions. So, like solarization of the cold chain equipments or solarization of the entire health facility to have to maintain the better uptake of the cold chain equipment and to maintain the vaccine potency. But yes, number one, there is a power reliability. Second is there is preventive maintenance and equipment repair timelines, which are inconsistent and from time to time in terms of uh, the equipment breakdown. Its response, the equipment breakdown response depends highly on the local initiative. As I was also mentioning earlier, like there are some good performing and some bad performing districts. So wherein there are districts or some areas which needs more efforts in terms of that. So where we have seen that where the preventive mechanism is being lacking, so that still remains a challenge. The program facilitates and program also advocates a strong uh, preventive mechanism to be in place. There are like uh, posters for the preventive mechanism, what to do during a preventive mechanism, how to do a preventive mechanism for the cold chain equipments. Those are the IECs also being displayed at the facilities so that it is ingrained into in the facility staff. Also, there is a one dedicated personnel and cold chain technician has been deployed in each district for the timely repair and for the preventive take of the cold chain equipments. So there are certain efforts which the program provides, but obviously that are some of the implementation challenges at the local level which needs to be addressed. Then there are at times certain when temperature excursions occur due to transport delay, or what we often see then, which again is an implementation challenge, is the improper conditioning of ice packs. because it's a humongous task to conduct a session site in India just with the sheer number of beneficiaries turning up. So conditioning of the ice packs, especially in the areas which are hilly or in areas which are very remote in deserted because of the gradient temperature zones, then that becomes an issue, and obviously a human error in terms of poor transportation of the vaccines. I think then difficult geography is one of a challenge also in terms of we have like mountains, there are certain forested areas, there are some insurgency affected areas. So this last mile connectivity at times becomes a challenge. How we are addressing this is now we are having cold chain refrigerated vaccine banks to maintain the potency of the vaccine during transportations as well. And we are also now looking up from some state-of-the-art technologies in terms of vaccine carriers, which provide the real-time temperature for uh, the vaccine carrier. So we are able to understand and know the vaccines are kept at an ambient temperature. So these are some of the factors which are also being considered. Nonetheless, the implementation and the human skills do not go away. So we still need a better preventive mechanism plan. We still need better conditioning of ice packs, better handling practices, so that the error from the human factor is minimized and the vaccine potency is not compromised. Thank you.
Thank you, sir. Uh, we really learned from that. So, sir, we're moving to integration, sustainability, and future directions of this system. Uh, what innovations or reforms do you think is most needed in the next 5 to 10 years?
So I think there are two, three things that clearly stand out. One is uh, there is one number one I would rate is predictive analytics and AI-based forecasting to anticipate stock out, to identify high-risk dropout population, optimizing session planning, and to have a longitudinal records of the beneficiaries. Second is the interoperable digital public infrastructure. Now we know that we are in a times when we are talking about interoperable systems. We no longer work in silos. So there should be mechanisms wherein we talk about integrating of human system with the surveillance systems, logistics, the electronic health records, so that it comes up in a complete packaged manner and we are able to analyze it at a district level or at a block level and to find the gaps that needs to be addressed. The third thing which I believe is community-linked immunization intelligence, like tracking of migrants. There should be behavioral insights in addressing vaccine hesitancy. There should be SMS nudges, use of vernacular reminders, frontline workers' decision support. We are always talking about the decision support system at an admin level. Can we also think about something at a frontline worker level, some decision support system at a frontline worker level, and so that they are able to address the queries of the community and able to resolve them more pragmatically. So, in parallel, like investments in workforce capacity, behavioral insights for vaccine confidence, and resilient cold chain system will always remain essential.
Thank you, sir. So, sir, we are reaching the closing part of this interview. The last one is there any insight from your experience that you feel is important for strengthening immunization system in India?
So, like over the period of years which I have worked now, I have realized one important lesson in the immunization success is not only about the number of vaccines which we are administering. It is more about the trust that has been built within the system, the trust the community is building in the system, the trust the frontline workers are building in the system. And so the system trust is foremost thing, I believe. The technology, policies, cold chain matter, but the final determinant is whether a frontline worker can identify, frontline worker can reach, they can counsel, they can vaccinate, and they can follow up every child consistently. So this is what the trust in the system has started to showcase, and which is witnessed through the consistent increase in the immunization coverages. So India's next, I think the next leap should be less on expanding the systems, but more on improving the system usability, through equity, data quality, and local problem solving capacity. So, like I say that strong immunization systems are built at district and community level, not only at the national level. So that community involvement and the trust in the system is the most important key for strengthening the immunization system.
Thank you, sir. Thank you, sir. Also, I think we have come to the end of this interview session. We really thank your participation, for your time. For myself, Dr. Shehu Yusuf, and One Public Health, we really wish you a great day. If you have anything to add, we can add, sir. Thank you so much.
Thank you so much for having me. Have a nice day.
Thank you. Thank you so much, sir.